Really appreciate the ability to have town hall meetings so we can express our opinions. I want to say first that I am opposed to rationing of health care. But the problem is, in our country, we have major rationing of health care. 47 to 50 million people, as we say, as we know, that's an underestimate, have no health care at all. During the course of a year, 83 million people have no health care. And those that have it, many of them are not able to take advantage of their health care because they can't afford the co-pays, they can't afford the deductibles. So we have rationing. I know that in 2008 we had major questions around health care, and I think the people in our country spoke very clearly. We want a change in our health care system. We've got to have health care so that people and we can't do without it. There is money for war, there's money for profit. Is to pass a health care bill that has the strongest public option, because that becomes
the gentle lady has the floor.
Let me say that I know that there are all kinds of lies that are out there. The media seems to want to tell us all kinds of things that are not true.
Please give the lady the courtesy you would want.
I mean, there are all kinds of lies, and we know they're lies. A lie went around for a long time that the president wants to kill our senior citizens. That's ridiculous. And everybody knows it's ridiculous, but we listen to the media. And at every one of these town hall meetings, the question gets asked, even though we know it's a goddamn lie. And I haven't seen any of our senior citizens, and I wouldn't give up Medicare, and I don't see anybody wanting to give up Medicare. Why can't all of us have Medicare? What I want to know, Congressman, is how do we guarantee that there will be a strong public option so that it becomes a real competition to the insurance companies that are creating the rationing that exists in this country today? That's a major reason for bankruptcies in this country.
If it's the will of the majority in the House and the Senate, it will happen. If it is not the will of the majorities, it won't. And it's too soon to predict if it will happen. Philip Bertha.
Thank you very much for coming, Congressman. I think we all really appreciate it, no matter where we are on the position. You mentioned a few times that nobody's going to be forced into the public option. I think you mentioned that to Lynn's question as well. The Congressional Budget Office said that millions of people would, in fact, lose their private insurance and be forced into the public option. The Lewin Foundation, which is our Lewin Group, which is a nonpartisan think tank, said it was 50 or 60 million people, and the Partisan Heritage Foundation said it was 80 million people that would lose their private insurance and be forced into the public option. I just wanted to, maybe if you can comment on that, and it does kind of make sense that if the public option costs $2,500 per person, and the company's currently paying, or union's currently paying $5,000 per person, you know, it would make sense if they would drop people and put them on the public option. So it does make sense.
Thank you.
Thank you.
Again, two things. What is the intention? What is the intention of the legislators, number one? And have they successfully accomplished their intention. I will give you my opinion as to what they intend. The intention is for the public option to be on a level playing field so as not to destroy the private health insurance industry. So that's the intention. But then the other question is, have they written this language sufficiently to guarantee that it will accomplish its purpose? Let me give you an example of the language that they use the language that they use. It's section 221. It says, it participates on a level playing field with private plan choice. Like private plans, it must offer the same benefits, abide by the same insurance market reforms, follow provider network requirements, and other consumer protections. So that is the intention, not to destroy the private health insurance industry. There is some, the Lewin Group has been described, I know you described it as nonpartisan. I've read material that said it was owned by an insurance company. Regardless of the source of the information. No, I understand. You know, the intention is for it to be a level playing field and not to destroy the private health care system. But I've written, when you see me whispering to Mark, my legislative director, it's usually to say, write that down, we want to work on that, I want that question answered a little better in my own mind. And in the preview, one of the first meetings, it was to make sure, see, I want to hear from the private health insurance industry whether the language is tight enough. Now, they may say, we don't give a darn if the language is tight or not, we don't want to take any chances. And I understand that point of view, but it may be my job to solve the problems, and the intention is right, and the language is strong and tight, airtight, then that's the best we can do. The other thing is, everything has changed. Social Security was written one way, and then the next year there were amendments, and the next year amendments, and the next year amendments. They learned as they went. And that happens with every single plan.
Now, that's what a lot of people are afraid of.
Right, that's the danger as well. That's the danger as well. So, Steve, you wrote it this way: what if the next Congress decides that they want to make it an unlevel playing field because they want everybody to go into the government health plan? My answer is that is the risk you have right now, that even if nothing happens this year, there's no guarantee that a Congress in the future can't simply say universal single payer health care. There is no guarantee. The only leverage that you and I as citizens of the country have is to throw the bums out or not elect them in the first place.
Right.
So that's a sufficient. So far, that has been a sufficient deterrent to universal single-payer health care in America, notwithstanding the fact that it exists in Europe and in Canada and elsewhere, in each of the major industrialized nations. We haven't done it. And I believe there's a good reason for it. We don't want nationalized health care. Not every American wants them. Although I'll say again, I would take Medicare and buy my own supplemental Medicare policy. If everybody in America could have it, I would want that and give up my private plan. I think that would be the best. But you should know, that's nobody's buying it. Not in the House, not in the Senate, not in the Democratic Party, not in the Republican Party. But I want to be honest and upfront with you as your congressman, because I think that would be best. But that's not on the table, and my intention is, as I've explained it to you, to respect the private health insurance industry and give this a chance to work the competition from a limited public health option for uninsured people who can either pick the public plan or not, and make sure it's on a level playing field.